Jayapal, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you so much, Secretary Becerra, for joining us today. Your work to promote health affordability and health equity, from your time here in Congress as a member of the House, to your tenure as Attorney General of California, to your current work leading the Department of Health and Human Services for the administration, has just been vital to our progress, and I am deeply grateful to you. The contrast between the priorities of my colleagues across the aisle and Democrats could not be clearer. When Democrats controlled the House, we passed bills that gave people the freedom to get the health care they need by expanding coverage and lowering costs. Now, this majority is pushing bills that continue to take away the right to health care, including gender-affirming care and abortion, while doing absolutely nothing to lower costs for patients. Secretary Becerra, my Republican colleagues have proposed federal bans on gender-affirming care, and more than 19 states have passed bills restricting care. What do medical experts say about the importance of access to gender-affirming care for transgender people?
Congresswoman, it is long-standing medical practice to offer gender-affirming care. It has been shown to not only provide for the physical health care needs of an individual, but the mental health care needs of individuals. And so whether it is because the science has shown us that it works, or whether it's because through practice we have professionals, doctors who can tell you how it's worked, we know that gender-affirming care has helped us bring some level of comfort and a better life for so many Americans who are in search of gender-affirming care.
And in fact, isn't it true that there's a long list of medical associations that endorse gender-affirming care and the positive health effects that gender-affirming care has for people with gender dysphoria?
That's correct.
There has been an increase in violent rhetoric and threats against transgender people and their doctors, including at children's hospitals that provide gender-affirming care. For example, Boston Children's Hospital received a bomb threat resulting in a lockdown. Secretary Becerra, how do you predict that this will impact children's mental health and safety?
Congressman, I think it's very obvious. If you see on the news that there are bomb threats, there are attacks, there's violence committed against those who are trying to help an individual who needs gender-affirming care, you take on the burden of saying, it's because of me that that person may have been attacked or harmed. And you also recognize that that could be me next, because they're attacking that person because of the care I need. And so the kind of stress that that imposes on any individual, including a young person, we can only imagine.
I know that HHS has taken action to address and increase critical care for trans youth. I want to thank you for that. Can you tell me a bit about your efforts to improve access to quality mental health care for trans people and trans youth, and why this has better outcomes for trans youth than removing their right to medical care?
Well, first and foremost, every American is entitled to get the health care that they need. And so transgender Americans are no different. And so we are doing what we're doing because it's their right. And we have an obligation to defend their rights and protect their health care interests. At the same time, we know that the closer we can get to providing them with that care, for example, in a school, the more likely that the child will have good outcomes, not just in terms of health, but in school and moving forward in life. And so we're going to try to put that care as close to that individual as we can.
Well, I really want to thank you, Mr. Secretary. I think you know I'm the proud mother of an incredible trans daughter, and I have watched the role that good medicine has played in her life and good care, health care has played in her life. My heart breaks for parents that are in states that have banned this evidence-based, life-saving medical care that kids need, and for those who face these coinciding increases in violent rhetoric against trans people. I am deeply concerned that this Republican majority continues to make this a priority for their time leading the House, restricting the freedom of families to make healthcare decisions over taking real action to tackle our healthcare crisis. It seems to me that if we did a poll across the country and asked Americans what they would want us to focus on, it would be on lowering the cost of prescription drugs, on lowering the cost of basic health care, making sure that seniors can get dental, vision, and hearing, other things that are critically important, not banning gender-affirming care for so many young people and trans people across this country. I want to thank you for your leadership. I yield back, Madam Chair.